Hello, everyone, and welcome back. Today, I want to talk about the drama that's going on at the CDC and with HHS Secretary RFK Jr. He was on Capitol Hill this week testifying before the Senate, answering questions about the recent firing of the CDC director. And this has obviously sent off a firestorm in the media. And so, what I wanted to do is I wanted to walk through this op-ed that was penned by several former CDC directors, kind of fact check in real time some of the things they are talking about, and then give you some other essays that have been published as well, commenting on this, because I do think this is important. I think, regardless of where you stand on, vaccines and that kind of thing, I think the MAHA movement is something everyone can really get around. I think being healthy is a good thing, and the fact that it's been politicized is quite alarming in my opinion. But then, like, you can just look at the facts around you. It doesn't take a rocket scientist. Like, you just go out in public and look, and people didn't used to be walking Oompa Loompas. Like, people didn't used to go to the doctor all the time for chronic diseases. And I've had my own experiences, so that's how this I'm shaped by this. And I've taken initiative to monitor my diet and exercise to mitigate some of the symptoms I've experienced over the years. But I think everyone can agree, if you just go outside and look at the world around you, it's not healthy. And the fact that we keep getting gaslit by health experts, I think is really concerning, because we saw with COVID how we were expected to put our blind faith and trust in these people who aren't elected and they're not accountable to us. We were told to believe them and trust them. And that didn't really turn out for our own good. And so as we move forward, I think it's important to restore trust in public health institutions. Otherwise, you are going to have people start rejecting the system writ large, and that's going to obviously create complications in the future. So I do think this is a really critical issue. It affects all of us, regardless of who you are, where you live, where you come from. Health is super important, and obviously it's something I'm really passionate about. And I think we need to find common ground on this instead of further politicizing it. So without further ado, let's dive into the essay. So it's titled, "We Ran the CDC, Kennedy is Endangering Every American's Health." So right away, like, RFK Jr. has been demonized as this evil person because he's skeptical and critical of vaccines, and rightfully so. I'll get into it in a little bit later why I think that's the case. But I think a healthy skepticism and a demand for science, like the actual practice of science, not talking about science, but actually doing the science, testing hypotheses, and being comfortably uncomfortable with the results, is important, and the current health establishment just doesn't do that. So again, this is written by several individuals here, and I actually posted a note on Substack a couple days ago breaking these people down. So they range in age. The oldest here is about 89 years old, and the youngest is 46, and they were all CDC directors for different periods of time. But just to give you some context of who these people are. So one of them is William Fogg. He's 89. He served as CDC director in the 70s. And he was the advisory medical board member on Theranos. And if you don't know what Theranos is, that is Elizabeth Holmes's basically made up fraudulent health company. Like, you were supposed to be able to, like, take a bunch of tests with a prick of blood, but like they fabricate the whole thing. There's a really great, I think it's on HBO, a dramatized series. It's either that or Hulu, I forget which one. But yeah, it's just a total fraudulent scheme. So okay, clearly his expertise should be trusted because he advised Theranos. The next guy here is William Roper. He's in his mid-70s. And he was asked to step down from his position in the 90s due to his response to the AIDS crisis. So the CDC is responsible for handling public health emergencies, and it's also responsible for guidance. So handling outbreaks when they happen. So like with COVID, for example, but also like guiding strategy and that kind of stuff. So some of these people aren't necessarily practicing physicians per se, but they're just more in a public health capacity. But anyways, he was there during AIDS and clearly didn't do a very good job, so he stepped down. The next one is 84. This guy also served as the Surgeon General, And from 2002 to 2012, he was on the board of Johnson & Johnson. And if you're not familiar with Johnson & Johnson, not only did they have a vaccine during the COVID pandemic, but they were also, like, there's been a huge lawsuit with them over talc and the baby powder and how it caused cancer. So who knows what he knew as a board member at Johnson & Johnson. But again, I have questions about that. The next one, Jeffrey Copeland. He began his health career in the 70s, and he was at the CDC in the late 90s, early 2000s. And there was at least one report I saw where he resigned because of how he handled the anthrax crisis. If you are too young to remember, shortly after 9/11, there was a bunch of letters that were mailed out. One was sent to like Tom Daschle and some other like people on important government people, and it had anthrax in it. So that was a big deal at the time. So he stepped down because of that. The next guy is Richard Besser. So Mr. Besser is currently the president of the Robert Wood Johnson Foundation. Yes, he wants you to know his pronouns are he, him. And his goal, one of his most critical public health goals at the Robert Wood Johnson Foundation, is to dismantle structural racism. So he says a bunch of stuff, and what their mission is to improve the nation's health. And he says, to achieve that vision, we are deepening our focus on dismantling one of the biggest barriers to health in America, structural racism. So that tells you where he sits. He's not highly politicized or ideologically motivated or anything. Okay, the next guy, Tom Frieden. So he served under the Obama administration, and he also started an initiative to prevent cardiovascular disease and epidemics. And so he's been funded by the Bloomberg Philanthropies, the Chan Zuckerberg Initiative, and the Bill and Melinda Gates Foundation. He also was charged with forcible touching in Brooklyn. I'm going to give him a pass on this, though, because this was during Me Too, and honestly, who knows if it's actually legit. Okay, the remaining ones who signed this, interesting enough, for all women. One, her name's Anne Schuchat. I didn't see anything controversial about her. She was a rear admiral in the U.S. Public Health Service. I had no idea that was a thing. But she seemed, pretty normal. Rochelle Walensky, she's in her mid-50s, and she was in charge of COVID under the Obama administration, and so she's a lecturer at Harvard now. And then the last one, Mandy Cohen. Her responsibility was to rebuild trust in the institution following COVID. I don't think she did a very good job in that, and she currently resides on a private country club in North Carolina. No qualms with really the last three. They don't really have anything remarkable to say about their experiences at CDC, but clearly, like, these people, I don't know, this doesn't seem like a pretty good track record. I'm sure I'm missing stuff too, but those are the people who penned this article. So why is that important? Because they open this op-ed up with an appeal to authority. So they talk about how they've each had the honor and privilege of serving as a director at the CDC, either in a permanent or an acting capacity, since the 1970s, and that they've served under both Republican and Democratic administrations. So they want you to know they're not politically motivated, and they're committed to saving lives and improving health. And this is a very blatant appeal to authority. They want you to trust them based on their expertise and experience running the CDC, but their qualification, like the receipts of the job they did, isn't necessarily a good thing. That's like the former chief executive officer of Bear Stearns coming to you, or even Enron, for example, coming to you and being like, okay, trust me because I managed this company and I did this. Like, no one in their right mind should accept financial advice from the former, heads of Bear Stearns or the Lehman Brothers, right? You should just use your noggin on that one. So I don't know that I would necessarily trust these people just because they served in a bureaucratic administrative capacity governing, public health care. So they immediately dive into why RFK Jr. is terrible and how he is destroying the nation's public health care system, even though he's only been in office for a couple months. And I would argue these directors have done more in the 50 years that they were responsible for overseeing the CDC than this RFK Jr. has done in the past few months, but, we'll dive into that. Okay, so one of the things that they call out here is Mr. Kennedy has fired thousands of federal public health workers and weakened programs that are supposed to protect Americans. So one of the things they call out here is heart attacks. Okay, so heart attacks are related to metabolic dysfunction, and that correlates to obesity. So we've seen a steady increase in people who are suffering from heart attacks, and that's directly responsible to obesity. So there's only 7% of Americans have good heart health. 93% of the country not in good health. So all of that decline preceded him. And there was a piece written here at Tufts University that talks about this. Only 7% of American adults have good cardiometabolic health. And they call this a devastating health crisis requiring urgent action. Okay, they say that right there. Okay, the purview of the CDC is to manage health crises and provide leadership and guidance on how to resolve those. So I would argue the obesity epidemic and chronic illness writ large that stems from obesity, I would say that is definitely under some sort of strategic purview of the CDC. So here they are using the fact that he's fired public health workers who manage programs on heart attacks. Like, he's fired them, therefore he's a bad person. But what have all of those thousands of federal health workers done in their decades of service to reduce obesity rates? Absolutely nothing. It's continuing to increase. It's becoming a huge problem. Like, what have these people done? So he's firing people because they're not doing their jobs. Not because he's trying to gut the American healthcare, establishment per se. He's not trying to hurt American people. These people clearly aren't doing their jobs. There's receipts, okay? Heart attacks used to not be as normal as they are today. They also talk about here, calling out the fact that he's been in charge of the largest measles outbreak in the United States in a generation, and he's focused on unproven treatment, downplaying vaccines. That's the big talking point here. All this is really about vaccines. And so let's go to the CDC's own data. Okay, so they'll be like, oh my gosh, you look at this and it's like, oh my gosh, we're suffering the worst measles outbreak in generations. It's crazy, blah, blah. Okay, so if you notice here, this is 2000 to present. Let's go back to 1985. Shocker! Look at that. All you have to do is expand the time horizon on the data that we're looking at, and you see that RFK Jr. isn't Satan incarnate. There are periodic increases over time in measles. Yes, if you're an unvaccinated population, which there are people in this country who are unvaccinated, this is going to impact them more, but that's not like that doesn't diminish his record at all. Like, net over time, like, measles is clearly down. And so the fact that there's a spike, which, visually here, it looks like periodically there are spikes. And over time, by the way, these spikes have been slowly increasing. And that all precedes his tenure in office. What did the CDC do in 2019 to prevent cases, okay? You have 1,400 in 2025 and you had 1,200 in 2019. Where was the CDC then? What were they doing? Okay. So it talks about here how he canceled investments in promising medical research that will leave us ill-prepared for future health emergencies. That's a nice one. He replaced experts on federal health advisory committees with unqualified individuals who share his dangerous and unscientific views. He announced at the end of U.S. support for global vaccine programs that protect millions of children and keep Americans safe. Okay, this is all gaslighting, right? Like, we just went through one of the worst health crises, I think, in all of our lifetimes. And we weren't prepared for that. So whatever he canceled probably can't be worse than what we've already experienced. The CDC wasn't prepared for COVID, right? So why, again, is RFK Jr. Satan incarnate for trying to rearrange, not just rearrange, but like trying to hold people accountable within the CDC and within Health and Human Services, in general? Like, why is he Satan incarnate? Like, how does this make us more vulnerable than the vulnerability we've already experienced? And then, he talks about he replaced experts with unqualified individuals who share his dangerous and unscientific views. Who gets to be the ultimate arbiter of qualifications? We have this elite class of like a new American intelligentsia in Washington, D.C., who think because they've served as a CDC director, they've gone to elite universities, that they're credentialed in certain ways, that they are therefore the arbiters of truth, and they're the only ones to tell us what is good and what is not. But clearly they're not doing the science themselves, right? Because if they had, COVID wouldn't have been as much of a debacle, especially the vaccine rollout, as it was. And then he talks about ending U.S. support for global vaccine programs. I just, this may or may not be related to this, but I just want to call this to your attention. You may not know this if you don't. The CIA used vaccine programs and global health initiatives to basically hunt down Osama bin Laden. So RFK Jr. may be shutting down vaccine programs. Again, there's no context there to know what he's shutting down, but maybe that's not necessarily a bad thing because we kind of have blood on our hands. We deployed a physician to administer vaccines in Pakistan in order to collect DNA that would lead the United States back to where he was in Pakistan. And so we've created global distrust in healthcare services now because of this. I suspect there's probably communities all around the world who, if they see a vaccine clinic come up, they're going to think twice because of this. So I don't necessarily know that we should hold ourselves up to a moral authority just because we support global vaccine programs, because we've abused those programs at the same time. Okay, and this final paragraph talks about how he championed federal legislation that will cause millions of people with health insurance through Medicaid to lose their coverage. Again, these are CDC directors. They're not HHS former secretaries. CDC is an agency within HHS, and CDC doesn't really cover anything to do with local medical care. And what's really striking about this language is it talks about how it will cause millions of people with health insurance through Medicaid. Health insurance through Medicaid. Right here, they overtly say Medicaid is health insurance, and Medicaid should not be and is not health insurance. There's a reason why health insurance exists. It's a flawed system. I get that. But the fact that they equate Medicaid with health insurance and that people are going to lose their coverage, I think it's a total non sequitur, and it's trying to appeal to the pity. They're trying to have us take pity on these poor people who are going to lose their coverage. When again, the coverage might not necessarily be warranted. I will give you an example. I have a family member who is on Medicaid. This family member does work, but because of the value of the benefits he receives through Medicaid and through other services, he's disincentivized from working full-time. So I don't know the case for everyone who's on Medicaid, okay? I understand there are people who need it for one reason or another. All I'm saying is we have a system in place that disincentivizes work and this is one example, because if you make too much, you lose the benefits. And it's also kind of an open secret that big companies like Walmart, for example, will intentionally not give their hourly workers health insurance because they know they'll be able to qualify for Medicaid. And so they basically treat Medicaid like a corporate subsidy. So again, I'm not saying get rid of Medicaid writ large, maybe empower the states more to take care of their own citizens rather than having the federal government do it. But I am saying that the system is flawed and people abuse it, not necessarily for malevolent purposes, but it's just the way it's structured, the way health insurance works. There are people who are on Medicaid who don't really need to be on Medicaid. And there are companies who benefit from underpaying their workers in order so that they can qualify for Medicaid. So it becomes a de facto corporate subsidy. So I think we just, need to look at more of the nuance and the details and not just, again, be like, oh, woe are these people who are going to lose out because of evil Mr. Kennedy. Okay, so again, it dives into residents of rural communities and people with disabilities will have even more limited access to healthcare. Again, these people aren't qualified to make that. They've started and opened this entire op-ed up with their qualifications, why they are experts and why you should trust them. And now they're talking about something that's not even in their purview. The CDC isn't responsible for rural communities, people with disabilities, and healthcare access. That is an entirely different system, something that is, again, complex and filled with corruption and hugely problematic. And I don't know that, RFK Jr. necessarily can fix it, to be honest. I think a lot of people are optimistic and hopeful that MAHA and that whole movement will fix the healthcare system. I think it's too far gone. So I don't even think, he'll even do that. And so then obviously closes it out by saying children risk losing access to life-saving vaccines. So I want to call your attention to one particular vaccine and why I personally am a skeptic. So I wrote this earlier this morning on Substack. Again, this is in response to a woman who has all her bylines in her profile. She's written for the New York Times, New Yorker, and again, it's this appeal to authority, as if people who criticize vaccines, we are lowly, we are incapable of having thoughts of our own. And so vaccines are what all of this is about, and you've probably heard the conversations or at least seen the conversations happening in the press with RFK Jr. being cast as an anti-vaxxer. He's also wants to get an answer to the autism epidemic. And this is something that is near and dear to my heart because my younger brother has autism. So I have a direct experience with this, and I wish autism on no one. I think the public discourse right now is conflating people with ADHD and neurodivergence with autism, and they are not one and the same, okay? Autism, especially people who are incredibly severe, just do not have the capabilities to function in society like neurodivergent people have. You might struggle with things if you're neurodivergent. You might have a hard time focusing. That's very different from being mute, which my brother was for a period of time, or being incapable of managing your emotions, having outbursts, and having to wear a helmet because you beat your head on the wall. There's a whole spectrum, right? Autism is a spectrum. There's a whole spectrum of how people with it behave, and the thing that people don't realize is it's children. Children get a lot of support. The public school system has done a great job. You have a lot of teachers and folks who therapists and all sorts of things that work with kids to help them develop the skills that they need to be successful later in life. So my brother, for example, had a speech pathologist when he was very young, and so because of early intervention and having a good just a good structure within the public school system to give him the support he needed, he's a functioning adult today. But some people don't have that. Regardless, like one of the issues with autism that really isn't talked about is that eventually these kids age out of the public school system. So whatever support these kids had as kids, once they hit 18 and they graduate from high school, they're just cast out into the world. There's no equivalent support in an adult world, right? So you have all of these autistic people who have to figure out how to live on their own. They have to figure out how to get jobs. In a lot of cases, they're not employable. A lot of them are on, medication, so they have to figure out, navigate the healthcare system, which in and of itself is highly complex. And so, we've framed like autism as this thing we should celebrate and be like, yeah, this is great, wonderful. And it's not. It's not. We've set an entire generation up of kids up for failure. And I think, the people who have firsthand experience with autism need answers. But you as a taxpayer should be demanding answers as well, because you're funding programs that are supposed to be like helping these kids. And if we continue like proliferating a population of people who can't function independently in society, like there's a cost burden. Okay, so I'm not trying to be mean and say like, oh, autistic people are bad. Obviously I love my brother very much, but there are some costs to it, and there's an entire like there's just so much that goes into it that I don't think the average person realizes if you haven't grown up with it, if you haven't been around it, if you don't understand it. It's taxing on families. Obviously I can speak as a sibling. It's taxing on siblings. It's taxing on the public school system, and it makes it really hard. It makes it really hard for everyone. So that's why I identify as a vaccine skeptic. I'm not an anti-vaxxer. I'm not going to say don't go get vaccines. I recognize vaccines are important, but I, like RFK Jr. and like others, have some legitimate questions. So one example is hepatitis B. So hepatitis affects the liver, and there are 3 strains of it, B, C, and D, that are transmitted through bodily fluids. And so there's 3 ways you can get Hep B. If you're sharing needles with someone, if you have unprotected sex with someone who is infected, or if you come across contaminated medical equipment or fluids in the hospital, for example. Those are 3 ways to get it. So Hep B is a vaccine that was introduced in 1981. Unironically, that was also the same time that the AIDS epidemic was officially called the AIDS epidemic. And what's interesting about that is HIV and Hep B are transmitted the same way. So they're not the same infection, obviously, but they're transmitted the same way. So I don't know if Hep B and like the need to create a vaccine came about because of the AIDS epidemic, and there was just this giant movement at that time to figure out what was going on. I don't know per se what the push was. All I know is Hep B was added to the vaccine schedule in 1991. So I was born in 1991, and my mother has looked at my vaccine records, as well as my younger brother. He was born in 1995. In 1991, I received all my vaccines 6 months after I was born. So there was a period of time where I, as an infant, a new infant in the world, wasn't born. My brother, on the other hand, in 1995, as soon as he was born, he was whisked away by nurses in the hospital, and he was immediately given vaccines. I don't believe I had the Hep B because it was too new at that time, but he would have definitely had Hep B. So this is a legitimate question. People, this has been a theory that's been put out there that vaccines caused autism. I'm not saying that they do, but there is some suggestion here that maybe the timing of vaccines could. If we didn't used to give kids vaccines, and then all of a sudden, as soon as they're bored, we're giving them vaccines. And the moment we made that change, there's been an uptick in the population, the number of people in the population that have been diagnosed with autism. I would like someone to disprove that hypothesis for me, do the science. But then also I have other questions like, why are we giving infants the Hep B vaccine? Okay, Hep B is effectively a sexually transmitted disease, or it's a disease that you're going to get if you're on drugs, right? So it's not something that any parent should be concerned about. Infants shouldn't be getting that unless you're getting like blood transfusions, right? But Hep B infects less than 0.5% of the population. So why is there a vaccine on the vaccine schedule for infants the moment they are born for a sexually transmitted disease that impacts less than 0.5% of the population? I just want an answer to that. That's all. And I think this is where RFK is coming at. And I think, this is why people are getting so riled up about this, because this isn't political. There's nothing inherently political about this. You have people who all of a sudden are starting to get diagnosed with autism at really high rates. As I mentioned before, there are costs to your family, costs to your community, costs to the economy that are associated with this that aren't accounted for. And we aren't able to ask these questions because it's been highly politicized. And so I take, great offense to this when these experts are like, children risk losing access to life-saving vaccines. Okay, well, is Hep B, is that a life-saving vaccine? Like, we're not talking about polio here, okay? We're not talking about smallpox. We're not talking about actual life-saving vaccines. We're talking about, things that have been added to the vaccine schedule, and we don't know why, because there isn't really a culture of informed consent in the United States. So we don't know why we're giving kids these vaccines. We're just told to do it, and if you don't do it, you're a bad person, right? And you can look back at the measles epidemic, or the increase in measles, and how he's been drugged through the mud in the public discourse over that. Again, like using the CDC's own data, you can toggle through the different time frames here and you can see for yourself, it's actually improved. Okay. So the next part here, it talks about how the CDC is under Department of Health and Human Services. And so during our CDC tenures, we did not always agree with our leaders, but they never gave us reason to doubt that they would rely on data-driven insights. I have a problem with the reliance on data, and I think this is just a phenomenon that's part of this bureaucratic elite intelligentsia class that we have in Washington, D.C. And you can just look at what happened at the Bureau of Labor Statistics as a great example. Like, it's come out recently that they were cooking their books, and the economy isn't actually doing as good as everyone thinks it is, and that's hugely problematic. For one, it's given people false confidence in the state of the economy. But two, if you're an investor or you're involved in capital markets, you're looking at data like that to make decisions and investment decisions. So if you've been making decisions for the past year or two on faulty cooked data, that has an actual material loss for you. Like, you could have made poor investment choices based on that. And it's possible, the Fed chairman, Jerome Powell, has been making decisions on whether or not to cut interest rates based on jobs data. And so you and I have been paying out the wazoo on interest rates, in part because of fake data, and data that was totally incorrect. So I don't know that I trust data-driven insights. And again, these people are using this appeal here to authority because, during their tenures, their leaders relied on data-driven insights. They weren't listening to quacky, kooky conspiracies like apparently RFK is. But it's clear that data-driven insights, at least in one other agency within the government, lied. So it's not unreasonable to believe that the same has also happened at CDC at some point in time. Okay, so then they talk about Operation Warp Speed during the first Trump administration, and it says it produced highly effective and safe vaccines that saved millions of lives during the COVID-19 pandemic. Okay. It didn't. I mean, I'm sure there's some people that saved too. Okay, maybe. But we've all been getting sick again. Like, all of us have been getting sick again. I put a note here. Okay, during COVID, Pfizer got a record profit. Okay, so this wasn't about keeping Americans safe. You've seen instances of myocarditis, like people my age dropping dead because of heart problems that they never had before. And I'm not just talking about like obese people, because I know that's been a talking point with comorbidities, and that was obviously put under the rug and kind of what people were hush hush about. I'm talking about like professional athletes. You have professional athletes who are dropping dead, people who are in the prime of their life who should have no issues at all, who are dropping dead because of myocarditis. So there's documentation that there are real bad side effects to this vaccine. It was pushed through. Science wasn't conducted on it because obviously you couldn't in that period of time. And then also you have the companies that developed the vaccines recording record profits for being able to be the ones distributing the vaccines. So I wouldn't say that they are highly effective and that they're safe. There's receipts. There's little receipts proving to the contrary. And these people don't want to be held accountable for their failures as public health leaders during a crisis, and how they exploited their authority and the environment at that time to convince all of us to take vaccines that have proven to be actually dangerous. Okay, so now this dives into why they're writing this op-ed and why Kennedy has been under fire. He fired the sitting CDC director, and it says, but when she refused weeks later to rubber stamp his dangerous and unfounded vaccine recommendations or heed his demand to fire senior CDC staff members, he decided she was expendable. So basically, they're saying he fired the sitting CDC director because he wouldn't push through his crazy anti-vax agenda. I'm gonna, move over to Axios here. I know Axios has its biases too, but I like how they show both sides of it. So, Monterez, the CDC director, she penned an op-ed in the Wall Street Journal that said Kennedy had told her to rubber stamp so that to go along with all of the vaccine recommendations from the Advisory Committee on Immunization Practices. And that group apparently includes some people with anti-vax rhetoric. Again, because of how this is politicized, you have no idea what anti-vax rhetoric means. Like, what I just described to you about Hep B, would you consider that anti-vax rhetoric? I mean, depending on who you're talking to, probably. For me, I'm just, a concerned citizen who has a lived experience with autism, and I just want some answers. That's all. But, depending on who you're talking to, anything that criticizes a vaccine or questions a vaccine is considered anti-vax. So everyone has been lumped together. And so that is her take. But then in a hearing in front on Capitol Hill, Kennedy denied that. And he said he never told her to rubber stamp anything, never told her to pre-approve anything. And so the reason why she was asked to resign isn't because she was unwilling to comply with his demands. It was because she was proven to be untrustworthy. And, that's probably not wrong. Like, the people sitting in Washington aren't as good as you think. They have this aura in the public opinion that they're these good people. They're hardworking. They're there for your best interest, and that is certainly the case in some instances. But a lot of these people, especially folks in the healthcare, you look at FDA, for example. These people are there to build social capital so that they can leave Washington and eventually use that, go to K Street, become a lobbyist. There's a revolving door, especially at the FDA, for people who are responsible for regulating pharmaceutical companies, and then they go and they move over to the companies, and basically in doing so, they're being hired to help the pharmaceutical companies figure out ways to get through the red tape that they themselves were previously responsible for administering, right? So it's a highly corrupt system. Regardless, this is he said, she said. I will say, it's hard. Again, it's hard to come to an objective agreement here. I will say, I do like how radically transparent the Trump administration is. They always invite the media into events. They're kind of very forthcoming about what they're doing. So that's my bias to believe Kennedy. It's not necessarily because I'm brainwashed and I think that the Trump administration can do no wrong. I think if you compare the Trump administration to the Biden administration, Biden, they hid his health, and I know that's been in the news with Trump recently, but they hid his health condition. And they, rushed in an alternative candidate at the last, the 11th hour, and in hopes of, vainly winning the election. But I think we all saw that they overtly lied. They hid it. We have no idea who's running the country when Biden was president, and it certainly wasn't him, right? So if you compare that to what's happening now, you can watch all sorts of public briefings. They take questions. Trump will invite reporters in and just ask field all sorts of questions. So I do like the radical transparency, and I think that seems to be a theme across the administration. So I suspect, because I had read somewhere else too, that he had individuals in those meetings with him. So I suspect these weren't one-on-one meetings. I suspect there were witnesses who could corroborate this, because that just seems to be what the Trump administration is doing right now. Okay. What is it? Okay. So he says they say these are not typical requests from a health secretary to a CDC director, not even close. None of us would have agreed to the secretary's demands. We applaud Dr. Monarez for standing up for the agency and the health of our communities. And they're appealing to a belief that might not actually be grounded in fact. And the corollary to this that we saw, I think in 2020, was the Hunter Biden laptop story, right? So you had 51 intel officers who penned a letter who said it was, Russian disinformation, blah, blah, blah. They used their appeal to authority in order to put out a narrative that has since turned out to be false. So these people are writing this op-ed using their appeal to authority, their previous experience as former directors of the CDC, and they believe that Dr. Monarez, the incumbent CDC director, is true because they're defending the status quo. They're defending one of their own. This is very tribal. RFK Jr. is kind of flipping the tables and upsetting the order of things and how business is done, and these people don't like that because they've all benefited from the system as it currently stands, and so of course they're gonna team up and defend the person who who has been a casualty in what's happening right now. So they say when the CDC was created in 1946, the average life expectancy of the U.S. was around 66 years. Today, it's more than 78 years. So they want you to believe that the CDC is directly responsible for this when, there's all sorts of different reasons why this could be the case. But one of the things I would call attention to is the obesity epidemic. Again, this is a health crisis. And so under their watch, these people were involved in the CDC from 1977 to, this is data from to 2016, but to present. Look at it, okay? In 40 years here, the number of people who have obesity has skyrocketed, And I think like last saw data in 2030, it's gonna be like 1 in 2 adults, right? So we have a crisis. This is an actual crisis. I've written a separate piece about this and did a different video about this, why I think we need to have a fat tax on obesity, because this is a public health crisis. I'll link it in the description below. But basically, we're reaching a point where this is not sustainable. Like, we can't keep physically growing the size of the population. We're not going to be able to provide the services we need. It's going to increase the costs. All of these people with obesity, right? They have chronic issues. They're using a lot. There's a correlation with that and Medicaid use and food stamps. So they're leeching onto the system. They're taking public funded dollars to basically support their eating habits, and that's causing a strain on the public healthcare system. So no wonder why expenses are going through the roof. You and I are subsidizing all of this, and so this is I would say probably the most important healthcare crisis of our time. And I'll show you a clip from Kennedy's testimony in a little bit, but he talks about this, how this is why this is a national security threat for the United States. And so these people, again, they want you to believe that we increased life expectancy, we did good, even though none of their work could necessarily be attributed to that. There's a whole myriad of reasons why life expectancy has gone up, but they won't take accountability for their failings. And one of the clearest signs is obesity. And again, you don't need me to tell you that. Just go to your local grocery store and spend 20 minutes just watching people. That's all you need to do, and you will see, oh my God, everyone is morbidly obese, which means they're sick, which that is the clearest evidence you need that your body is sick and it cannot function. Okay, so they end this by saying, we have a message for the rest of the nation as well. This is a time to rally to protect the health of every American, okay? So their goal with this is to protect your health and my health. So they say Congress must exercise its oversight authority. State and local governments must fill funding gaps. Philanthropy and private sector must step up through community investment. Medical groups should continue to stand for science and truth. And physicians must continue to support their patients. Okay, so you have Congress, You have state and local governments, you have philanthropy and private sector, medical groups like the American Medical Association, the American Diabetes Association, because, they're not taking any funding from Big Pharma or Big Food or anything, and physicians. Okay, we gotta trust all these people. It never once talks about you and I. The implication here is that you and I don't have agency over our own healthcare choices, over how we eat, over how we move our bodies. We have no agency at all. Like, we are fully dependent on these people because of their expertise and authority to help us get through the crisis that they are responsible for ushering in. Like, where was their leadership as obesity was starting to skyrocket, right? Where was it? Because I'm not seeing it here. The evidence is clearly showing that they have spent decades of failing. And then, you look at their resumes here and where they're affiliated with. Like, okay, you have Theranos, Bill and Melinda Gates Foundation, Johnson & Johnson, this guy's Robert Wood Johnson Foundation, Chan Zuckerberg Initiative. These people have all moved on. They've moved on to the private sector to capitalize on their expertise and their credentials working at the CDC, and in order to further, their careers and their own objectives. So I do think that's kind of what this is all about. So I want to dive in now to a response to this. So this was written by James Lyons Wheeler in the Maha Report, and this is on Substack. And it's a memo to the New York Times, what these former CDC leaders didn't prove. And this kind of dives into some of the stuff I was saying as well. But, it opens it up by talking about this is written to sound definitive and yet supplies no evidence to counter the realities the public knows well. It relies on status, insinuation, and catastrophic framing, and then asks the readers to treat all three of these as evidence. And this is, I think, the problem we're facing with our relationship with the media right now, and why it's important to do like live fact-checking exercises like this, because there has been this continued appeal to authority, appeal to status, and confusion in how things are framed. So example, like, okay, the health life expectancy has gone up, and that is being framed in a positive light, but it's completely ignoring a lot of the other negative consequences that have come out of poor leadership from the CDC. And so it confuses evidence and fact, and I think that's why it's gotten so hard for people to discern information for themselves. We're now fully reliant on these people in the media to tell us how to think even. So it says this is not analysis, this is reputation management disguised as alarm. I'd say this is true. The authors front load their credentials, yep. They tell us they are former directors or acting directors of CDC under Republican and Democratic presidents. Okay. The question is, what did they accomplish during those 100 years, and whether the public should accept the views of risk uncritically? Yeah, so these people, again, if you're going to use your appeal to authority, like, you need to bring receipts on why you should be trusted. And these people, like, have brought none. They just want you to trust them simply for the sake of who they are. And that's just not sufficient anymore. So it says, when real world data showed the vaccine failed to stop transmission, the goalpost simply moves. So he's talking about vaccines here. And it's not, so one of the things that strikes me about this is, obviously, there's the stuff he talks about here, how standards were rewritten in real time, no one publicly dissented, or if you did publicly dissent, you were canceled, and we saw that, just look at how Joe Rogan was framed. I mean, there's that famous picture of him on CNN, and he's got like a greenish overlay to make him look sicker. And they called him, crazy for taking ivermectin and called it horse dewormer. Like, we all saw this. We saw highly qualified, equally qualified, no less qualified experts who were thrown under the bus simply for raising objections. And it talks about here how none of these people objected when myocarditis signals started to emerge. No one raised their voice when the definition of vaccine itself was quietly updated. And I do remember this. It was updated. A vaccine is something you used to get once, okay? Like, I got, the MMR, the measles, mumps, rubella vaccine, right? You have to have that to go to college. I don't get an annual shot to ensure I don't get the vaccine. I don't ever get that, right? There's some you have to update, like tetanus and things like that. But for the most part, a vaccine is like you're getting an inoculation against a disease. The COVID vaccine isn't actually a vaccine. It uses a completely different technology. It does a completely different thing within your body's immune system. You're not actually giving your body a piece of the virus to then replicate and create natural defenses against. And a great example of evidence of this is, okay, we have yet another COVID vaccine coming. It's 2025. Okay, I think most of us are kind of over COVID. I've had it, to my knowledge, a couple times. It really felt like the flu meets a sinus infection. It was unpleasant. But it was nothing I would ever get a vaccine for. I don't even get the flu shot. And that's just my personal preference. You can do whatever you want. But the fact that in 2025, we had a mandate to get the vaccine. You had cards and everything. There were boosters, and now it's become an annual shot. Really tells you what this is all about. It's just to put another thing on the vaccine schedule, get us habitually on it, so then Pfizer and all those companies can cash in on it. But you have to ask, if this is so effective, if the COVID vaccine was so effective, why does it have to be re-administered annually? Oh, I went back to the wrong one. Okay, so the further, if the authors believe warp speed is the model of health and leadership, they must also explain its fallout. So there were excess deaths, increasing and all-cause mortality trends in the young, documented myocarditis and menstrual cycle disruption, immune imprinting, reducing booster efficacy. And these aren't fringe claims, these are published findings. Like, these are things people are coming up with, and they're sharing their findings, but because of how politicized this has become, because of how everyone who disagrees with the vaccine is suddenly an anti-vaxxer, anyone who calls into question COVID is suddenly this crazy MAGA person. Like, all of the politicization of it is obfuscating this data that is coming forward. And so instead of doing the science, instead of critically analyzing it, folks who are opposed to the Trump administration, opposed to what RFK Jr. is doing, they're just, blasting him in the media. And so who are we to believe, Again, we're ignorant people. We can't think for ourselves. So that they want us to believe what, the narrative. Okay, so it talks again about how, RFK apparently canceled research, but it doesn't cite which studies, what topics, or what endpoints. I think that's a really good point. I'm also kind of critical of the research industrial complex. You have all this money, like millions and billions of dollars that have been spent on finding a cure to cancer. And again, it's 2025 and we still don't have a cure to cancer. And I'm just where's the return on the investment there? Like, I just, like, what are we doing? What percentage of research dollars are actually going to research? And what percentage is going to lab equipment and salaries? That's all I want to know. Okay, the op-ed asks us to accept institutional claims the way it once asked us to accept modeling estimates, test thresholds, and pandemic guidance because they say so. And this is the real threat here. You have, again, people in positions of authority, people who are not held accountable, electorally, or in this case, if they don't do their job, and then this is why I think all the firings and the cuts and stuff happening in Washington are cutting such a deep nerve with people. It's because it's the first time they're being held accountable for their behavior and their actions and failures in their jobs. There's, you're rewarded for failing in Washington. Like, that's the culture there. And so this is, this is what this is all about. It's a piece in the media asking us to accept the beliefs of people who have otherwise a terrible track record. Okay, so this goes into one of the Global Vaccine Alliance, and then, talking about that, and then it says, when the CDC faltered in 2020, it was not because one leader failed to have their back, it was because the agency lost the public's trust by suppressing dissent, shifting goalposts, sticking to disproven and harmful narratives, and behaving more like a political actor than a scientific one. That's absolutely true. I mean, we have receipts for that, right? Like, as I said before, like, they redefined what a vaccine is. You see the data on Pfizer's balance sheet, like, they clearly made a profit there. What was the incentive behind that? They didn't conduct science. It's really hard to conduct science when you only have a year to get a vaccine pushed through. And of course, the thing that's really stressful or like frustrating about all of this is just how gaslit we've been. So you have COVID-19 came from gain of function research that was being done in China. We had previously, scientists in the United States were like, this is too dangerous, we're going to put a moratorium on it, we're not going to do gain of function research. So instead of like adhering to that, they just moved the research overseas. The virus got out, created a global pandemic, and so no one to this point has been held responsible for any of that. So you have on the front end all of that, okay, and then you have on the back end all of the consequences of it. People who have died, myocarditis. People are going to have lifelong vaccine injuries because of this. And it does happen. It's not like these people are perfect. Like, things do happen. But because no one wants to take accountability, we're never going to have, like, this tells you what the next pandemic is going to look like. And it's kind of scary to think about, okay? If this is what we went through with COVID, what's going to happen when the next one comes around? So the current restructuring under Kennedy may be uncomfortable for those who spent decades defending the status quo, but discomfort is not disproof. That's absolutely true. Just because he's disrupting the status quo doesn't mean he's wrong. What it reveals is not Kennedy's failure, but the author's complicity in the largest public health disaster in history. That's absolutely true. I'm giving you, the example of obesity and how that has led to a chronic health epidemic in this country. You can also look to COVID. Those are two really good examples of how the authors of that op-ed were complicit in massive public health disasters that have cost people lives, cost people jobs, cost people obviously their health, and it's costing you and I taxpayers millions of dollars every year because of the consequences of that. So I want to conclude with a post that Nick Sorter put on X, but it's Kennedy talking during his hearing on Capitol Hill, and he really hits home the point that this is about holding people accountable. These people didn't do their jobs. He cites here that 76.4% of Americans now have chronic diseases. And he says, when my uncle was president, it was 11%. In 1950, it was 3%. So there are people alive today who remember a world where people didn't have chronic disease, and now chronic disease is more than 3/4 of our country. And the crazy part that he cites during this is 8 out of 10 of our kids cannot qualify for military service. That is a national security crisis. 80% of young men cannot qualify for military service. Our adversaries know this, y'all. Like, this isn't hush hush. They know that we can't fight a future war, and that should alarm every single American in this country. But let's dive into what he says.
Yeah, Senator, this morning I got the latest numbers from CDC that 76.4% of Americans now have a chronic disease. This is stunning. When my uncle was president, it was 11%. 1950, it was 3%. Today, it's 76.4%. 8 out of 10 of our kids cannot qualify for military service. This is a national security issue. When my uncle was president, we spent 0 on chronic disease. Today, we spend $1.3 trillion. It's the biggest cause. It's increasing. And all of the arguments that Republicans and Democrats have about single payer, Obamacare, or with the various ways to allocate the health dollars, they're all like rearranging deck chairs on the Titanic. If we don't end this chronic disease, we are the sickest country in the world. That's why we have to fire people at CDC. They did not do their job. This was their job to keep us healthy.
Thank you,
and
Mr.
I need to fire some of those people to make sure this doesn't happen again.
Thank you.
Yeah, so I mean, this is the problem with all of this in the framing, and why it's important to pay attention is because by using appeal to authority, by politicizing the vaccine rhetoric, by framing him as this crazy conspiracy person who doesn't believe in science, your people are missing the message. Like, at the end of the day, it doesn't matter. We have a fundamental problem in this country where people are chronically sick with things they shouldn't be, like, they're easy to solve, right? Like, diet and exercise would solve a lot of these problems. Things like diabetes and heart disease and all that kind of stuff. People are suffering, people are dying because they're sick, and they're sick because we live in a sick care system that profits when they continue being sick, okay? And so we can't even attempt to solve or fix that if we can't get past the conversation that maybe RFK Jr. has maybe he's saying something right. Maybe there's something we need to listen to. You don't have to accept everything he says. You can disagree with him on vaccines if you want. But this is the core message I think we have to listen to. And this is what I think the whole MAHA movement is all about, is we need to get America healthy again, because it is sick. It is costing us money. You and I are paying for it, but it's going to cost us our safety and security in the future when we don't have a fighting force ready to defend the country during a future conflict. And I think, that should be incredibly concerning to a lot of people. So that's what I have for you today. If you enjoyed this analysis, I would love it if you'd like and subscribe. Also, hype this. Apparently there's a hype button you can push. I didn't know that, but it helps smaller creators get boosted in the algorithm. So definitely give it a hype, and I appreciate you watching. And if there's anyone you know who you think could benefit from this, please share it with them. Otherwise, I'll see you in the next video. Have a good one.